Most Finnish people can't wait to get vaccinated against COVID-19. At this vaccination center, around 3,000 doses are prepared and administered every day. It's around 40% more than should be possible with the supplies available. That is because a Finnish invention makes it possible to make a little bit of vaccine go a long way. The person behind the creation is nurse Sari Roos, who was among those starting COVID vaccinations in December last year. We don't want to throw away any viable vaccine. It has become paramount to use the vaccines as economically as possible, especially after some of them were limited to certain age groups only. Roos works in a public hospital but volunteered to do extra vaccination shifts. She fine-tuned her technique within the first few days of preparing the doses. Once I noticed that exchanging the syringes and getting rid of excess air in the equipment guaranteed 2 extra doses of vaccine, I sent an email to our medical director. He quickly contacted health authorities about it. Everybody was very excited. Roos's technique requires syringes with a 1 millimeter capacity and small scale. The syringe is first filled with vaccine, but just enough to get the required vaccine dose. In addition, a bit of air is drawn from the vial bottle into the syringe. Finally, the air and vaccine inside the syringe need to swap places before the vaccine is administered. The air bubble technique maximizes the amount of vaccine that is extracted from each vial. For instance, it makes it possible to prepare 7 instead of 5 BioNTech doses, as well as 12 instead of 10 AstraZeneca doses. Health experts made Roos's technique their official recommendation for COVID vaccinations in the country in January. Despite its benefits, Norway is the only country to follow Finland's footsteps. Medical director Timo Karpeen from the city of Helsinki so far hasn't had the time to advertise the method globally. Some teaching materials have only recently been translated into English. I think this technique can be copied to other countries too. To be able to vaccinate 40% more people than originally projected is simply incredible. For the world to reopen, however, it is not enough to vaccinate people in just one country. While nations such as Finland are continuously easing restrictions, other parts of the world are only starting their own vaccination campaigns.